Question. A 78-year-old patient with new-onset atrial fibrillation is started on warfarin therapy. The patient is also receiving amiodarone and reports eating a diet rich in leafy green vegetables. On day 3 of hospitalization, the patient becomes confused and slightly hypotensive. The INR is 5.4 and there is mild oozing from the IV site. What is the most appropriate nursing intervention? A. Continue monitoring and recheck the INR in 12 hours. B. Hold the warfarin and notify the provider of the elevated INR. C. Administer protamine sulfate as an antidote. D. Encourage the patient to reduce intake of green vegetables. Answer. B. Hold the warfarin and notify the provider of the elevated INR. Rationale. An INR of 5.4 indicates a significantly increased bleeding risk in a patient on warfarin, especially when clinical signs of bleeding, e.g., oozing from IV site, new confusion suggesting potential intracranial bleeding, and hypotension, are present. The safest, most appropriate nursing action is to hold the next dose of warfarin and notify the provider immediately. B. Warfarin effects can be potentiated by amiodarone, which inhibits warfarin metabolism and raises INR levels. Option A is incorrect because continued monitoring without intervention delays necessary safety measures. Option C is incorrect because protamine sulfate is not the antidote for warfarin. Vitamin K is. Option D shows misunderstanding. Green leafy vegetables actually contain vitamin K, which lowers INR. Reducing them would increase the INR further. This scenario demands that the nurse recognize a complex drug interaction, warfarin and amiodarone, evaluate clinical signs of bleeding, interpret lab results critically, and initiate appropriate communication to prevent harm.